Despite the advances made in cancer research and treatments, cancer therapy still remains hit or miss. Joining us now is Dr. Chris Apfel of Sage Medic with some hope for cancer patients struggling with standard cancer treatments. Doctor, thank you for joining us.
It's my pleasure to be here.
Why does cancer therapy remain hit or miss, even in this era of precision medicine?
Yes, well, that's a really important question. And many people ask me that. Cancer is incredibly complex, and each patient's cancer is really unique. And so, although we understand some of the genetic changes that can affect those cancer cells, this information only touches the surface. For instance, if you think of Keith Flaherty from Harvard, who published in 2020 the results of the National Cancer Institute's Match trial, he was actually able to show that only 1 in 4 patients could be matched to a targeted therapy.
Wow.
And even then, no guarantee is given that this therapy will actually work. So that at the end of the day, only 1 out of 10 patients today benefit from genome-driven targeted therapy. So they're in what we think is precision medicine.
It's hard to believe in this day and age with the billions of dollars that are donated to cancer research that we're still struggling to find a cure, that we're still struggling with therapy. What are the limitations of the current standard of care?
Yeah, let me start with saying that standard of care is really important to ensure a consistent level of quality of care. And in many cases, a deviation from standard of care actually can lead to inferior patient outcomes. So standard of care is really important. As a physician, I strongly believe this. However, standard of care often is based on, let's say, randomized controlled trials, which provide strongest level of evidence for the effectiveness of an intervention. But as Dr. Peter Attia points out in his book Outlive, these trials often assess a diverse group of patients to determine an average result, which drug would be better. But every patient is different. And so while effective for the many, this approach of standard of care in thinking about how groups, which treatment is best for a certain group of people, overlooks the uniqueness of each patient's cancer in the field of oncology. And therefore, consequently, treatments that work well on the average may not work well on you or on individual differences that can very significantly impact cancer outcomes.
Why is self-advocacy so important for cancer patients? I mean, you mentioned the fact that there's so many different cancers, there's so many different approaches. You really have to know what you're dealing with going into that doctor's office to make a plan for yourself.
Right, that's right. If you have an early stage small cancer that has not metastasized to other organs, standard of care and surgery from one of the large top cancer centers of the National Comprehensive Cancer Network might actually be all you need. However, if you have a progressed tumor that is stage 3, stage 4, that may already have metastasized to other organs, you might actually want to take the matters really into your own hands. In a way to speak up for your health. Dr. Arakel Giorgio has a very nice podcast on that I would actually highly recommend to anybody to listen in, how you actually can participate in making better informed decisions. And I would also recommend that you go with your partner, with your friends, or whoever think you might be helpful, because if you're diagnosed with cancer, you may not fully understand what your oncologist is telling you because you are under high level of stress.
Sure.
One of the things that I would also highly recommend is look at patient advocacy groups. For example, Brad Power has a so-called cancer patient labs, and you can join there. They invite experts, they discuss cases, and they have open discussions for a wide range of cancer that might help you a lot.
Real quickly, you mentioned a diagnostic approach. We just have a few seconds left here, Doctor. How does the test work?
Yeah, so we have developed the Sage Oncotest, and that's important because traditional pathology only uses formalin-fixed and stained tissue to evaluate the structure to make a diagnosis. But formalin fixation kills the tissue, which limits the ability to predict accurately which therapy is likely to be most effective. And that's the reason why we developed a technology that enables us.
Very good, Doctor. Thank you so much. For more information, here's where you can go, sagemedic.com. We're back right after this.